Cooper University Healthcare is developing a new program to better serve patients of all ages with intellectual and developmental disabilities, which we'll refer to as IDD. These patients may have autism, Down syndrome, and many other conditions. The hospital environment can be stressful for anyone, let alone individuals with intellectual and developmental disabilities and other patients that may have sensory sensitivities. We are taking steps to meet the needs of these patients to reduce stress, anxiety, and agitation so the patients can receive the medical care they need and their families can feel more comfortable in the hospital setting.
People with IDD may process or interpret information differently. Some individuals may experience typical lighting as especially bright, and sounds may be overly loud to them. They may not be comfortable with touch or the feeling of an unfamiliar sensation on their skin. These sensory overloads can lead to stress and agitation, leading to aggression and ultimately behavioral challenges. This can make providing care more difficult for patients, families, and providers. Cooper is using new strategies that are effective in leading to a better patient experience and better outcomes for the intellectually and developmentally disabled patients.
There are 5 pillars to this program: the creation of a specialized care coordination team, education for all team members, enhancement to electronic medical records, sensory support for patients, and establishing a patient family advisory council. We've hired a specially trained navigator dedicated to the care of patients with IDD. We've also begun a specialized training and education for all Cooper nurses, critical care technologists, and other team members so that they know the best practices and protocols for caring for patients with IDD. We've built several multi-sensory rooms across the hospital campus, currently located in the emergency department, pediatrics, and radiology. These sensory-friendly rooms are therapeutic spaces with special lighting, soft and textured surfaces, white noise generators, fidget toys, and interactive elements. Our team also has mobile sensory carts available that can be deployed to any patient room or unit to help patients during potentially overwhelming or overstimulating situations. An IDD patient registry has been created within Cooper's electronic medical records system. This allows clinicians to document patients' specific needs for better coordination of care, bridging the gap between parents, guardians, caregivers, and specially trained hospital care teams. Finally, we've recruited a patient family advisory council composed of family members, guardians, and caregivers of patients with IDD. Our advisory council provides valuable feedback on the services and care provided at Cooper, allowing us to listen and learn which aspects of the program are most helpful and where adjustments should be made as the program grows and evolves.
At Cooper, we are committed to providing patients with intellectual and developmental disabilities with the same advanced care we provide to each of our patients. We are confident these strategies will successfully create better patient experiences and outcomes and reduce the level of stress on patients and their families. Thank you for the trust you've placed in us.